All right. How's it going, everybody? I'm waiting on my counter partner here. And so we can do a little live. Here she comes. Dr. C, welcome to the party.
Hello.
Okay. So, all right, here we are. Lunchtime live. It's been a few weeks since we've done one of these. I hope everybody had a great Thanksgiving holiday and people were able to enjoy their holiday without a lot of pain, discomfort, and issues with COVID. So we are here this week going over some frequently asked questions about stem cell therapy. So we have a pretty um, common question list of things that people typically excuse me, come to us with when in regards to stem cell therapy. So, Doc, before we jump in, give us a little kind of a 30,000-foot view of you as a physician and our specialty here at Regenerative Sports Spine and Spa.
Okay, I was trained actually in physical medicine and rehabilitation, so bone, muscle, joint doctor essentially. And I also, after residency, did an extra fellowship in spine and joint injections specifically. So that's basically my expertise. And I've been doing spine and joint injections for the last 17, 18, 19 years. How long has it been? Somewhere around there. And then I branched into the stem cell therapy, regenerative medicine in the last 7 years or so. So, and that brings us to today.
Very good. So, what was it about stem cell therapy that really kind of was a game changer for you that made you go, you know what, we're going to do this?
So, I had been doing at that point general spine and joint orthopedics for 10 years or so. And what I noticed was I kept seeing the same people over and over again and for the same procedures. And after a little while, after a few injections or a year or two, typically these injections also stopped working. And so then they were in pain, but, it's like, and then it's like then surgery was the only other answer after that, because typically by the time they came to see me, they had already done the medications as well as physical therapy. And then so then they come to me for the procedures. And then after the procedures stop working, really the only option is surgery. And so I was looking for another way to treat and trying to get these people better and for longer term, so that it wasn't like the limited options that we had then. And a friend of mine had knowledge of the regenerative medicine, and so I started treating with that about that time, and then branched into further and further treatment options after that. So
Nice. Very good. So, and switching to stem cell regenerative medicine, those kinds of things have obviously come with their own roadblocks and questions, and people who feel like this is maybe too new or there's not enough research, there's not, there's conflicting information out there. So let's clear some of those questions up as a result, as it relates to stem cell therapy. So, what do you hear is the most common I guess, reason to question why stem cell therapy works? What is that thing that you see a lot of?
well, I think most people, they say that there's not enough research, but even though in our society, probably in the last 2 to 3 years, it's really kind of blown up as a treatment option. It's been around in Europe for at least 20 years. And then actually in the States, I know that the original folks on the West Coast started maybe 10 years ago, and then we branched out into the East Coast after that. And there are tons of studies out there on platelet rich plasma, as well as bone marrow stem cell and fat stem cell, and the comparisons of all of them. And then there's also a lot more recent studies coming out with comparisons of platelet-rich plasma versus steroids, which, as those of you don't know, it's like steroids have been shown to have a lot of detrimental effects when used over and over time. And these studies have just come out recently on those as well. So
Right. So in the world of stem cell therapy, I know we get this question happens a lot is how long does it take to actually see the benefits from having any one of these procedures done?
that is variable. However, think of it this way: it's taken years for you to get to the point where you're in, let's say, this much pain, or there's been this much damage to, let's say, the knee joints, the cartilage, the ligaments, or let's say the discs in your back with some degeneration or arthritic changes or nerve issues. So typically it takes years to get there. So repair is going to take longer than most people want to wait. However, typically after we do a treatment, most people start feeling better at a month, which is actually pretty quick. The regenerative process can take anywhere from 3 to 12 months. And so, but, you know, it's like in my practice, I see most people feel really good by the time they get to the 5th or 6th month. So, you know, first 1 to 3 months is when you start noticing the differences. Then we start working on everything else that's maybe imbalanced in your body, and then get everything working together. And then everything kind of gels together around the 5th or 6th month.
Yeah, which will lead me into a question I know that comes up about a lot as well. If it's going to take that long for me to get better and we don't really know if it's going to work, why wouldn't I just go ahead and have surgery?
Okay.
If surgery can fix my problem like that, then why wouldn't I just go ahead and do surgery instead of waiting to see if the stem cell therapy is going to work for me for 6 more months?
Well, fix is not really a proper term. There's nothing in medicine that actually fixes anything. So surgery is not actually a fix, and it's not quick either. So typically recovery from surgery takes at least 6 to 8 weeks. Then you're looking at actually improving. It can take, if you ask spine surgeons and knee surgeons, it usually takes 9 to 12 months as well. So, and typically sometimes even longer. I mean, there's people that don't get better for a long, long time. And then on top of that, you're changing the structures in the body. Let's say you're, you know, if you're doing a discectomy, you're taking a piece of the outer covering off, which is protective, which actually destabilizes the discs, and then, or putting metal in your body. And so those are unnecessary risks that you don't, you know, it's like, if we have another option that's more natural, why not do this that actually can do repair or help repair some of the damage naturally, and then also get your pain better.
Right. So what is, and one thing, this is something I know comes up a lot, is what is the difference between well, let me back up. We see a lot of people tout stem cell therapy, but there's only a couple places where real stem cells that are viable alive come from. So what are those two places?
The two places are the bone marrow and the fat.
Okay.
Tissue.
And so a lot of places who tout stem cell therapy are using a different type of tissue. And can tell everybody watching a little bit about that.
So there's other tissues available, and we don't call them stem cell therapy, although some people might, but they don't typically have live stem cells after they are thawed, because they are amniotic fluid, Wharton's jelly, exosomes, all types of regenerative treatments out there. But true stem cell therapy, live stem cells only come from the bone marrow and the fat. There are some people that say the Wharton's jelly has live stem cells, but it is for a finite amount of time. So you also have to think about, if it's only for 5 minutes, by the time you actually inject it into the body, is it truly live? Still, more than likely not, you know, so that's the difference. However, you know, those regenerative medicine treatments, they can still help quite a bit with some of the, you know, healing and repair and things like that we would like to see. However, in my experience, when we do the live stem cells, it actually works a lot better. And over the year, you know, 7, 8 years, that's what I've noticed, is like, if we use a regenerative medicine, it does work, but the live stem cells work a little bit better.
Yeah, and I think the overall concept would be, if you can, use material from your own body versus a donated material. Not that we don't know what's in it or it hasn't gone through testing, but using your own body's tissue to help you heal, and knowing that there's live cells in that is obviously the better way to go, depending upon your body, right? There are some limitations there as to whether or not we should use your own cells. So what would be some of those limits? Why there's some points where we're like, you know what, we want to do bone marrow, but we don't do bone marrow. And so what would be some of those? This is a question that comes about a lot, is, well, should I use my own tissue or should I use somebody else's? and why at certain points should we not consider using our own tissue?
So the one of the main reasons why we steer people away from the bone marrow or the fat would be if you're a smoker. Actually, it's one of the biggest things is that when you're a smoker, it actually affects the viability of your cells, and so then they're not as potent if you are smoking. So typically, if you're gonna if you still want to use your own, we have you stop smoking for a while, at least before and after. And then hopefully you'll quit altogether because then all of your cells will work better in general. So there's a reason why, the nicotine affects, or the smoking affects your cells. It just doesn't make them as viable. So anything that you're trying to heal in your body doesn't work. So you're promoting more damage over time. So if we can start by getting you off and then keep you off, then it's better for everything in your body. So that's one of the biggest things. If you have any blood disorders, things like sickle cell, it's like those kind of things, we tend to, steer you towards maybe regenerative medicine instead. But any other medical issues that can affect your bone marrow or your fat, those are going to be the ones that we want to make sure that we are careful with that.
Mm. And you mentioned bone marrow and fat being the two most relevant sources of stem cell therapy. We don't do fat in our office. And why is that?
So there's some regulations with the FDA with the fat as well. There's only one kind you can use, and that's basically either we can't use any enzymes to separate the fat particles from the stem cells. And so you can use gravity to separate the bigger particles, but even the smaller particles tend to, have a little bit of fat attached to them. And so that is with the amount of blood flow that you have, especially spine, is going to be really a risk. So we don't want to cause any embolus. And so that's why we use the bone marrow rather than fat in our office. However, if it's a joint issue, you can use, either or both, so there's a lot of people that do that. But for my purposes, I think just the risk of getting into the bloodstream with even the tiny, tiny fat particles are a little bit too much risk for us.
Yeah, just to clear that up, an embolus is when you have a fat particle that gets stuck somewhere it's not supposed to be. If they have a fat embolus, and that can cause things like strokes or blood clots or what else? They can get stuck in your lungs.
Yeah. So
You can,
just blocking blood flow, and so that's not really what you want to do. You
yeah.
want to
So,
improve it. But speaking of that, it's like if people wonder about the which one is better with the fat and the bone marrow. So fat has been known to have more content of stem cells. However, there was a study that came out in 2019 that compared fat and bone marrow, and the effect ended up being very much the same or similar to, so no real difference, even though the fat had the more number of stem cells. So it's really not necessarily the number that matters so much as the quality. So.
right. Got it. And so, walk me through the process of bone marrow. What does that look like? How do we get bone marrow from our own body and then use it to inject in shoulders or knees or spine or whatever it may be?
So basically, we go into there's an area, so I should have brought a model, but so there's an area in between your spine and your hip joint. And then that's basically what's called the PSIS. So I go into that bone with a needle, just tap it in gently, and then go in and remove bone marrow. And then what we do is filter it and then concentrate it. And so then we get the bone marrow that's without all the red blood cells and everything that can cause issues. And then basically we re-inject it. So that's it. So all in one day.
Nice. How long does the procedure usually take?
Usually between an hour and a half, you'll be at the office. So really not that long. And yeah, typically, with the spine, we take a little bit longer just because it's a little bit more delicate area.
Sure. Very good. And then let's wrap this up with the question that I know everybody asks. Is stem cell therapy covered by insurance? And why is it or isn't it?
Well, we're getting into a little bit of an interesting discussion with that one, but the short of it is insurance does not cover it. which can be for a number of reasons. When you talk to the insurance companies, they'll say because the FDA isn't allowing it, but it's like the FDA hasn't come down on either way, particularly on the live stem cells in the bone marrow yet. So, or they'll tell you that there's not enough studies, which, if you do some research, there's tons of studies out there. So it just depends on your viewpoint. But the FDA has their reasons for right now. It's like, and the insurance follows them, but they are not covered at this point. So maybe sometime in the future, but it is not.
Yeah, I know there's always a little bit of a weird discussion that's around that usually involves politics when it comes to
Right, exactly.
that kind of thing. And a lot of people tend to get aggravated the fact that they pay money to their insurance company, and why doesn't insurance cover certain things? And there's a lot of reasons for that without getting too political. But I would venture to tell you that typically you get better care, better customer service, and typically better outcomes when you venture outside of what your insurance company pays or doesn't pay for. So yeah. Any other closing questions, things that are frequently asked that you can think about before we end our rant?
I think that, so one of the questions I get is downtime, right? So typically the first 2 or 3 days, people do need like pain medications there. You have to basically stay at home, stay off of work, those kind of things. And the downtime really is about 2 weeks. And then after 2 weeks, you can get back to your normal activities for most people. So that's really just something to consider. So we just have to plan it accordingly when you come in and when you're able to do it. So that's just something to keep in mind. So downtime.
Awesome. Very good. Well, Dr. C, it's nice to be back on the lives with you again. If you're watching this post-live broadcast, try saying that 5 times fast. Drop a comment if you have any questions or about stem cell therapy or things you've been thinking about, if you've been considering it. We'd love to jump in and answer any questions that you guys may have. We get a ton of them. I think we could probably put together a 2-day show just on the questions that we get. So hopefully we answered some kind of 30,000-foot questions for you guys today, but feel free to drop some other ones in the comments. And next week, we'll be back with another Lunchtime Live to talk more about regenerative medicine. So I hope everybody's doing well, staying safe, and we'll see you guys soon.